Greetings, ladies and gentlemen. This is your friend, Dr. Jaime Daniel. I do love to share with you information about some disease. Some of them maybe are rare, another maybe are common, or maybe you are suffering from one of them. So I think it is very important for you to pay attention into what I'm going to tell you today. And today I want to talk to you about osteonecrosis. Remember, the bones of the human body are made up of living cells that need a blood supply to stay healthy. In osteonecrosis, blood flow to part of a bone is disrupted. This results in death of the bone tissue, and the bone can eventually break down, and the joint will collapse. Osteonecrosis is also called avascular necrosis, aseptic necrosis, ischemic necrosis bone. Osteonecrosis can happen to any bone, but most often it develops in the ends of long bones such as the thigh bones, known as femur, especially the upper part, the ball in the hip socket. The lower end, which is part of the knee joint, it is also often affected. Upper arm bone, known as humerus, especially the upper part, the ball in the shoulder joint. When the disease involves part of a bone in a joint, it can lead to a breakdown of the bone and arthritis. Less often, the bones of the elbows, ankles, feet, wrists, and hand are affected. The primary symptom of osteonecrosis is pain, and doctors usually diagnose the disease using imaging methods such as X-rays or magnetic resonance imaging. Most people require surgical treatment to prevent further bone damage, to protect the bones and joints, and to improve use of the joints. People of any age can get osteonecrosis, but it is most common in people in their 30s and 40s. Causes of osteonecrosis that stem from an injury are said to be traumatic, while all other causes are considered non-traumatic or atraumatic. We have identified a number of risk factors that may make a person more likely to get osteonecrosis. However, some people who get the disease do not have any known risk factors, and we can list some of them. Injury. When it happens, a broken or dislocated bone or a joint injury may damage the surrounding blood vessels. This can decrease the blood supply to the bone and lead to osteonecrosis. Ironically, the medications can also make you suffer from it. For example, the corticosteroids. These medicines commonly used to treat asthma, arthritis, systemic lupus erythematosus, for short lupus, and other conditions, act by reducing inflammation. While the reasons are unclear, they increase the risk of osteonecrosis when they are used for long periods at high doses. The risk of osteonecrosis is low when they are used on a short-term basis at lower doses. Excessive use of alcohol is a risk factor for osteonecrosis, but why it makes people more likely to develop the disease is not clear. Overuse of alcohol can cause fatty substances to build up in the blood vessels and can increase cortisol levels in the blood. Remember, cortisol is an hormone that can cause blood vessels to narrow. Together, this may decrease blood flow to the bone and lead to osteonecrosis. Research has also shown that excessive tobacco use is also a risk factor. There are also some medical conditions that may increase the risk of osteonecrosis. Some of them are certain blood disorders such as a sickle cell disease, certain types of cancer such as leukemia, decompression sickness, also known as diverse disease, Benz or Caisson disease, Gaucher disease, gout, HIV infections, pancreatitis, rheumatoid arthritis, and lupus. Some medical interventions may increase the risk of osteonecrosis, for example, chemotherapy, kidney or other organ transplantation. The use of corticosteroids to avoid organ rejection may be a contributing factor. Radiation treatments also. We have described two types of osteonecrosis. One is the traumatic, which follows an injury. The most common causes of traumatic osteonecrosis are bone fractures or dislocation. And we have, by the other hand, the non-traumatic or atraumatic, when there is no history of injury. There may be no symptoms of osteonecrosis at first, but as the disease progresses, you may gradually start to feel pain, especially in weight-bearing bones, such as the thigh bones, remember, the femur. The disease most commonly affects the hip, and the pain is usually felt in the groin or less commonly in the buttock area. Most people first experience pain when they put weight on the affected joint, but eventually the joint may feel painful even when resting. Over time, the joint may stiffen and lose its range of motion, and osteoarthritis may set in. If the end of the bone collapses, the pain may intensify abruptly. The time period between the start of symptoms and loss of function of the joint varies from person to person and ranges from a few weeks to more than a year. Osteonecrosis happens when the blood supply to part of a bone is disrupted, depriving bone tissue of essential nutrients and oxygen. If the affected part of the bone is small and not subject to major weight-bearing forces, it may not cause a problem, or the body's repair processes may be able to rebuild the damaged area. But in most cases, the repair mechanisms do not work and the bone erodes or develops fractures eventually. It may break down and collapse. In traumatic osteonecrosis, which develops from an injury, the loss of blood flow is likely due to the damage to the blood vessels. The reasons for the loss of blood supply are less clear in non-traumatic cases, but may be due to blood clots blocking the circulation or elevated pressure within the bone, constricting the vessels and decreasing blood flow. While the underlying causes of the non-traumatic osteonecrosis are not fully understood, scientists believe that genetic, along with other factors such as alcohol overconsumption, certain medication, and other diseases may play a role. Well, thank you. I hope you enjoyed this episode, and we will see you in the next one. Goodbye.